Welcome to the operating table. We discuss medical treatments, conditions, and symptoms, all from the perspective of the patient. We let you ask all the questions that you never knew to ask, wanted to ask, or maybe you never got to ask your doctor. And that's what this program is all about. My name is Najib Thomas. I'm the medical director at Crescent City Surgical Centre. I'm also a practicing neurosurgeon. And we're here today with one of our patients, Celeste. Celeste, tell us a little bit about yourself.
Hi, my name is Celeste, and I work at a hair salon in Mid-City, New Orleans. I'm the manager, and I started having some symptoms of like tingling in my arms and legs, and
Some things are going on kind of different, huh?
yeah, I was in some numbness.
When did you first start noticing? 'Cause you go to work, you're living your life, you're hanging out with your family, and then what was the first thing you noticed?
Well, I just kind of when I turned my neck a certain way, I would get like tingles kind of down my arms. Maybe that's what started off, and then it progressed to like my legs, and it was just constant. And then
Constant in both the arms and the
arms
legs?
and legs, the tingles. And then I started to experience some numbness in my fingers. And obviously it affected my writing and
And over what period of time this occurs? So you began to turn your neck 1 or 2 degrees or 1 or 2 different ways and began to get tingling in your arms, then you got tingling in your legs,
yes.
and then you got numbness. When did you know this wasn't, as patients say, I got a crook in my neck, doctor? When did you know this was something different than what you had experienced previously in your life, or maybe you needed to take it a little bit more seriously?
Well, it had been going on for probably 6 to 9 months, and I originally just thought, oh, it's a pinched nerve. I kind of just brushed it off, but things had progressed. So I finally decided I needed to see someone, just because I didn't want it to be more serious than I thought it was.
So like everybody else, when something happens that's abnormal, you have a pain,
Yes.
tingling, numbness, your arm's not working, in this case you were like, okay, this is going to go away, I slept on it the wrong way, let me take some Tylenol, let me take some ibuprofen,
Right.
let me just, bury my head in the sand, it'll go away, right?
Correct, yeah.
But in your case, it didn't. It started progressing, meaning one arm, then both arms, then both legs. And let me ask you this, when did you really get concerned? When did you were like, okay, I have the tingles, and it's kind of funny that you say that because in your mind the tingles probably aren't a big deal because it's,
Yes.
it's something you give a cute name to. And
Right.
But when did you realize, okay, Celeste, I can't dismiss this. I need to see a doctor, and this is getting worse, not better. It's not heading in the right direction. What was the sort of breakthrough moment, if there was one? Because that's what I think people want to hear is like when is it serious that you need to see a doctor?
Well, I probably should have went a while ago, but I really got concerned when I started to feel the numbness and like the strength in my hands.
And describe that numbness to people. Numbness is lack of sensation, inability to
Yes.
feel. Like, how is it affecting your day-to-day life? Like, what you were doing? Was it the keyboard? You mentioned penmanship earlier.
Yes.
Was it like putting on
Gripping.
jewelry, that kind of thing?
Gripping things, like I felt like I didn't have as much strength in my hands, and yes, writing as well, and just in general doing anything.
Were you
But-
dropping things?
Yes, but also I didn't mention this earlier, but I was very off balance. I would run into things as well.
Your arms and legs aren't working correctly. They're numb. You can't use your hands correctly. You're having trouble walking, and now you're in an enclosed space that's really noisy for an hour and a half and probably thinking, what the hell is going on in my life, right?
Yeah, so it was very scary because I've never had any surgery before or any kind of experience like that. Never really been to the ER. So it was just really different. I just had to like calm down and just breathe and just lay there for an hour and a half. And they give you headphones that has loud music, but it still doesn't mute the noisiness of the MRI. But they're very nice over there, whoever did my MRI, and talked me through, okay, you have to be real still at this moment and all that. So they explained everything to me.
So the music was more of a distraction really than muting out the noise. It kind of just... And what'd you listen to? Was it like Lizzo, Barry Manilow?
No, it
What
was
was it?
some kind of rock music.
Okay. Rock music. Okay.
I don't remember exactly.
Do you get to choose?
I don't remember that.
Okay. Just curious because I've never had.
I mean, it helped. I guess it wasn't just noise, so it was kind of. It was fine though. Once obviously I did it, I was fine. It's just the whole.
Were you glad to get out the
nervousness
tube?
going
Were you
into
like,
it. Yes.
holy cow, this thing's
Yes.
over, huh?
Yes, yes, because I think I had to do partial with when they insert something in you. It was a contrast.
Okay.
As well, so.
Wow. So
Yeah.
it was like a whole morning affair. I mean,
Yes.
registration, starting the IV, sitting in the MRI for an hour and a half, listening to heavy metal music, and trying to mute out the sounds of the MRI. I mean, wow, hell of a morning for you, huh?
Right. Yes.
Wow.
It was definitely different.
So it's so fun for me to hear this from a patient's perspective because, I'm ordering MRIs, we're worried about getting insurance approvals, and we talk to patients about them, and I've seen it, but it's just it's so great to hear from your perspective and know what you're going through because it's really scary, I mean.
It is.
When did you know there was going to be a major issue? Did you hear it in his voice? Was it something that he particularly said? Or like, okay, they're calling me, so, maybe they're calling me to say everything's okay? I mean, when did you get the feeling?
I mean, I kind of got a bad feeling that it was calling me over Christmas break, so I was like, uh-oh. So, of course, he tells me all this stuff, medical terms, and I'm like, okay, and he's like...
Did you understand what he was telling you, or you kind of had an idea,
I mean,
or like...
sort of, kind of. I mean, obviously, from a doctor's perspective... it was something serious, and I didn't get the total scope of what it was until, obviously, I saw,
How long was the phone
you
call?
don't.
Do you recall? Or it's probably all a blur? I mean,
it's all a
2
blur.
minutes, 10
I mean,
seconds,
I
right?
think he told me I had, spinal stenosis, compression, bulging disc, spinal cord.
So your
damage.
Your impression after that phone call, your belated Christmas present, we'll call it, is that, hey, I've been having this numbness, tingling, my legs aren't working, I'm falling into things, and oh, by the way, the MRI we just did shows your spinal cord to the deli meat on a sandwich and being squished. Is that kind of your understanding?
Pretty much. Yeah, I was very scared. I didn't expect it to be to that extent.
Who's the first person you called?
Well, he had asked me if I needed a referral, and I said, well, I kind of, I knew of someone from a lot of our clients. Some have seen him, and just by reputation, I heard great things, so I called Dr. Thomas.
To your head then now, it's now, you see me around the 4th or 5th of January, I think the 4th. And what's going through your head? You're nervous about coming to see the doctor, or you're excited, hey, you've gone through this journey now 9 months or so, and you know what the cause is, and maybe you're going to get some definitive answers, or kind of walk through what's going through your mind, because it's a scary process, because you know you have a problem, but you really don't know how to fix it, and you're putting your trust in someone else's hands to do the right thing for you.
I mean, I was very scared. I mean, obviously, it's been a while, so to remember all my thoughts, but I just know it was completely scary. Like
you're
I said,
nervous
I've
now
never...
thinking about it, I can tell.
Yes.
You're getting a little shaky,
It was just like unreal. Like it could be my life. Like I didn't think that I would ever have to go through something like this. So, yes, to hear that I actually had a diagnosis and I wasn't just crazy and just randomly had these weird, problems was comforting, but also scary in the same respect. So,
it's almost like a oxymoron or paradox in the sense of you're like, I know I have these symptoms. There's a reason for it. I'm not cuckoo.
yes.
But on the other hand, I heard you say, this can't be my life. This
Right.
can't be me, right?
No.
It's always, the other person like we talked about. So kind of interesting. Because everybody thinks that. I mean, no one wants to think that they have the diagnosis that the doctor gives them. And we see that. Sure, it's my MRI. I mean, look, we checked your
right?
name. So you come and see me. Describe that process a little bit. And, I see you ask you questions, similar many of those that I'm asking now, and examine you. Few things would, after seeing you and examining you and explain to everybody what, in your words, what the MRI showed, and, how did I do interviewing you? And it's okay to be critical, okay? We've already done surgery and we know you're here, so explain that to everybody. You go to see the doctor that day. Walk us through that process a little bit, if you could.
I mean, your office was great. Everyone over there.
They are.
Yeah. they were super nice, and Christy's great. Love her.
Christy's a nurse practitioner, everyone, so.
It was, like I said, it was scary, and I had to bring my mom with me just, for moral support.
Always got to bring your mom. There's nobody like having your mom.
Yeah.
I know.
So it was just, just getting there and all that, very smooth. Getting in the office, I was just, like I said, just really anxious at the time and just wanted to kind of, get it over with, know what was what and what I was facing, and go from there.
When you saw the MRI, and I explained this to you, and the spinal cord being pinched and really compressed,
Yes.
and I spent some time explaining to you, what the spinal fluid around the spinal cord, because normally for our viewers, the spinal cord is surrounded by fluid. It makes it very buoyant. But in her case, her canal was small and there was no fluid around her spinal cord. When you saw that and knew that that was you, what was going through your mind?
I couldn't believe it. I mean, I remember you telling me you needed to make sure you had the correct scans because I basically looked like I had a spinal cord of a 55, 60-year-old.
That's right. You had advanced degenerative changes. When I look at you, I mean, look, you're young, you're vibrant, you take good care of yourself. You haven't spent your life up partying or doing things that would, affect your spine. And so when I did see your MRI, you're exactly right. It was surprising to see the magnitude of your compression, and it looked like someone who had a MRI that was much more advanced than your age. So once you saw that, but did it become clear to you that obviously after reviewing that MRI with me, something really had to be done?
Yes, absolutely. But, it was obviously when you explained everything and all that, obviously I was still taken aback by the magnitude of what would actually have to be done. So I had to think on that. And I mean, obviously you wanted to do surgery right away because it was severe.
Right, and so everyone knows once we examined Celeste, we found many more neurological deficits, weakness in certain areas, abnormal reflexes. So the symptoms that she was talking about earlier really had deteriorated even further. And so there was some urgency, not emergency, but urgency in order to do this surgery and unpinch the spinal cord. Did you experience some relief, knowing mental relief, meaning that, okay, now me, Dr. Thomas, is going to have to, Najib's going to have to unpinch this spinal cord? Was there some relief knowing like, okay, I'm getting closer to the end of the journey? Were you more nervous? What was your feeling? Tell everybody about that.
I mean, probably a mixture of feelings. Yes, it helped to have an actual diagnosis and a solution. But it was still very scary because I had yet to go through the surgery. So, but yes, it gave me some peace of mind to know, what I had to go through. But like I said, it was still scary on the same respect.
Sure. So that date, which you came in and got the diagnosis, reviewed the MRI scans, and really had a clear understanding of what your problem was, and we picked a date within, I think, 10 or 12 days, something like that, for surgery. Tell us, what was it like the next 10 or 12 days? You continued to go to work? Did you try to keep your life consistent, have a routine and pattern? Did you have some sleepless nights? Did you reread the letter and the consent 4 times over and try to block things out? I mean, tell us about that. People want to know.
Well, I tried to basically return to life as normal. Obviously, I couldn't pick up a certain amount of pounds because, he advised me against that because of the compression and all that. But no, I tried to just zero in and do my normal life. That way I wasn't sitting there freaking out every day until the surgery.
That's an important point.
Yes.
You really should, when you need surgery or any type of medical condition, you get a medical diagnosis, live your life normally, because where you were yesterday and today and tomorrow most likely are going to be the same. So brooding over it, the old saying, worrying's like an old rocking chair, it moves around a lot but doesn't go anywhere. You maintained your normal life, but probably kept your routine, kept your sanity, and got your mind off of it.
Yes.
After you left the office, who was the first person you called to let them know you were having surgery? You had your mom with you.
Yeah, I had my mom with me. Probably my boss and my friend, just to let her know what was going on, because it was serious. And
Did you cry in the car?
I don't remember exactly, but I know there was some crying, whether it be then or, it was just very, alarming. And I remember being in your office and you explaining the procedure to me, and obviously it went straight over my head because it was all, it just didn't sink in right away.
Yeah, a lot of patients tell me that once you hear you need to have surgery and look at the MRI, even though we spend detailed time,
Yes.
you're kind of like in your mom. Thank God you brought your mom with you. I didn't hear anything after he
Yes.
said that. And Dr. Thomas said that I didn't hear words. That's not an uncommon reaction. When did you realize or begin to understand exactly? And if you could explain to people in your words, not my words as a doctor, what surgery we did, which was unpinching the spinal cord. But explain, when did it sink in after my appointment but before surgery that, hey Celeste, this is what's going to happen to you over in 10 or 12 days, and explain to them in your words what was done to you and feeling from your perspective.
Well, after we got out of the office and I spoke with a couple of people, told them exactly what surgery I would be having, I did actually Google it because I knew exactly what the surgery was called. So I just kind of did my research on it and tried to just understand exactly what, was going to happen as well. Because when I was in your office, obviously things didn't totally
Process correct.
Correct.
You undergo the surgery, and the next thing you remember is being in a room, which is your patient room. Okay.
Yes, correct.
Where you spend the night in the hospital after surgery.
Yes.
Okay. So give everybody an idea what goes on is after our surgery, which is in the operating room, you have a breathing tube down your throat. We have a bevy of people in there, anesthesiologists, nurse anesthetists, scrub techs, surgeons, OR circulating nurses. We wake you up safely. We remove the breathing tube, and then we take you to something called the post-anesthesia care unit. You may have heard the term recovery room, okay? We don't use that term anymore. We call it the PACU, P-A-C-U, post-anesthesia care unit, where you're waking up from anesthesia. It takes some time for the drugs to be removed from your body to clear them, but also we got to wake up and make sure that your vital signs. You're pulling enough air, your oxygen levels. Sometimes
Yes.
you get reactions to medications that will elevate or reduce your blood pressure. So we watch you there for a period of time to determine that it's safe to move you to an area we'll call lesser acuity, which means there's not 2 or 3 nurses hovering over you at one time. You're then brought down, in our case, from the 5th floor to the 4th floor to the patient care room, which is your own private room here at the hospital, and where you're now wide awake, and that's sort of the first thing that you remember.
Yes.
When you remember, tell us about it. Did you ever feel like you had a lump in your throat? It was like, wow, the tingling and numbness is gone? Like, what was the first few things that were going through your mind?
Well, my first thought was obviously I couldn't really move my neck because I had a C-collar on. But when I think I was kind of out of it still, so I don't remember exactly. I just know, yes, my tingles and numbness were gone.
Those tingles
And-
again, yeah, they're now gone.
No, they were gone. And I just felt kind of groggy, but obviously I could tell that. And then, of course, I couldn't move my neck because I had the C-collar.
Color on, it was
Yeah.
restricting you.
Yes.
So a few hours later, when you wake up a little bit more and sort of come to your senses, and you're not punch drunk from the anesthesia anymore, and then you realize the tingles and the numbness is gone.
Yes.
Tell us a little bit about that feeling where you realize, wow, I haven't had this in 9 months, and then tell us about the first time you got out of the patient bed and walked. So.
I was amazed that they were gone. I mean, obviously that was the whole point of the surgery, but, and I felt minimal pain. Now, granted, I was on pain medication, but I felt minimal pain, and when I walked for the first time, I think it was fine.
Sure.
Like, I think I felt
You weren't
okay.
falling into the walls or falling over like before?
No.
When did you feel, so you go have surgery, the next day you go home,
Yes.
when did you really start like walking around, I know you're walking around the house that day, but sort of get outside? One of our instructions, we don't want people really going in a car unless they have to.
Yes.
You could, there's potholes and there's people that hit you, but when did you really feel you have your sea legs and started walking around outside and walking, some reasonable distance to realize, hey, this has really altered my life. My balance is back, my tingling is gone, the tingles, I should say, I'm not going to say tingling in front of you again, I'm always going to call it the tingles as a noun. And but realized the tingles were gone, you could use your hands, you could walk up and down the pavers in the yard and not fall. And what was that realization like, and when did that occur?
Wow, I'm trying to remember, but I would say probably a good maybe like week. Like I felt better, like maybe even a couple of days.
Gotcha. You realized it wasn't coming back.
No. And I don't know, I guess responded so well to surgery and just healed quickly, so I felt even no pain within probably a week.
Did you have any anxiety the first couple of days when you felt better, that you're like, oh, this is almost too good to be true? Is it going to come back? Or you just kind of like, this is it, I know it, it's not going to come back?
No, I didn't think it was going to come back. I was just nervous because I never obviously had a C-collar before and all that, and I didn't want to turn my neck a weird way. So obviously just getting used to the C-collar and just having to wear it and how to sleep with it and all that was kind of challenging.
Yeah, everybody says, doctor, I didn't want to do anything to screw it up, And
Yes, correct. Because I mean, obviously, it needed to be done. I didn't want it to have to get it redone.
No, you don't. When I tell people all the time, I don't want to screw up your surgery. I said, listen, it's our surgery, okay? Because your body's healing, and as part of it only that I'm assisting with. So, so you are now, a few days out. You're walking. When did you resume work?
Realistically, I probably could have started sooner, but Dr. Thomas advised me to stay home for 6 weeks.
Yeah, I didn't want you going there. And Celeste is a very hard worker.
Yeah.
She'll do things. She will not follow the restrictions. So if someone needs some heavy box or something moved around, she's going to do it. And that's why I knew that. Most people can go to those types of jobs in a couple of weeks. But I know you're a kind heart and a kind soul. You'll just be there to help somebody if they need it, or walk somebody downstairs in a car. And I didn't want them,
Yes.
falling over and hitting your neck and that sort of thing.
Yeah. Well, no,
So-
I appreciate the honesty. I
No.
mean, obviously I said I could have done it, but I didn't want to do anything to potentially, have a setback or anything like that.
The experience of surgery, coming to Crescent City Surgical Center, and the post-operative period, when you came to see Christy and I, and we checked your wound, in that sort of 2-week period, what was most surprising, or what kind of went through your head? I mean, you were obviously certain things you were anxious about, and maybe afterwards you're like, I shouldn't have even worried about that, but something maybe like, oh, I didn't even think about that, but it was actually something. Or what was going through your mind in that period? Like, it's over, I went through it, obviously, but give everybody a little flavor.
I was just trying to be extra careful because I didn't want to, move a certain way because I was always like a neck cracker. So like I never wanted to, obviously do anything to harm the surgery. So I just kind of, like I said, just resumed somewhat normal life. I did kind of work from the phone. I couldn't, help with some things at work because obviously,
Sure.
Can't be there. And couldn't really travel for 2 weeks in a car
Sure.
because of, his instructions. But no, I just actually felt pretty good. Like I said, I didn't have any tingles or numbness anymore, and the pain in my neck was very minimal.
Was there anything after surgery, did you have that feeling like, wow, I'm so glad it's over and I should have done it sooner, or this wasn't as bad as I thought, or?
Probably all of the above. I should have went to the doctor sooner. I should have, obviously not ignored it, but it definitely wasn't as bad as I thought. And like the recovery, just all of that, because when you're talking about the spine, obviously it's scary because you never know what could happen in surgery. But I mean, I had full faith in you, of course.
Thank you.
But it's still scary in the same respect.
It's scary every day. We don't
Yeah.
take it lightly. Every
No.
surgery, you're only as good as your last surgery. And so it's like anything else. If you're a truck driver, you're only good as your last haul, right? So
Yes.
you have to be good every day. And that's what we try and strive to be. But in your case, it's great to hear from your perspective about things you were nervous about, and after surgery to help patients understand, really I did well and was able to get through it. Many things that I was worried about really weren't an issue. Now we're over 2 years out.
Yeah.
You're back managing the salon,
Yes.
living your life like you want to.
Yes.
Plan on going out. Did you go out this past New Year's?
I don't think so. I'm not a big New Year's Eve
So you went,
person.
even though your neck was fixed, you
Yes,
went to bed at 12:01, right? After having your
No,
lunches? Okay.
no. I just, I'm
Gotcha.
not a big partier.
So we talked about ignoring your symptoms and,
Yes.
and not doing that. That's really important, and not letting things progress. Is looking back on the whole experience and having done well, obviously, is there anything that you could give advice to tell other potential people out there who have similar symptoms, or people who've had surgery or will have surgery? If you could sort of describe in your mind or give a piece of advice or two, what would you tell them?
I would tell them, do not ignore your symptoms. If you are feeling something different, listen to your body, go to the doctor right away, and, obviously listen to his advice. And if you do need to get surgery, everything will be okay. It's going to be nerve-wracking, but just trust the process and have trust in your doctors and all the team. And just know that it's going to be fine, and you'll be better after for it.
Well, look, it's been an honor to help you, to serve you, and make your neck better. And I remember how nervous you were, and we looked at your images like it was yesterday, thinking, this can't be me.
Right.
But you've done so well, and thank you for being generous with your time. Not
Absolutely.
for me, but for all those people out there that are watching this that want to understand what are some of the things as a patient that I can encounter and see. And you've done a great job explaining that. I don't want to keep you away from the salon because I know they might get mad at you.
No,
but,
it's fine.
Thank you for coming. And any final thoughts? Anything you'd like to say?
Well, I just want to thank you, your team, and everybody here at Crescent City because they were fabulous. For my first experience, it was bar none. I mean, my mom can even attest to that. She's had surgeries in her past, and she said this is probably the best experience she's had, even though she technically wasn't the one going through it, but she was here witnessing all of it. So just want to thank you so much.
Well, thank you
for taking me on, and appreciate it, and everyone out there. Yeah, Dr. Thomas Ross.
Thank you. Well, look, it's our privilege both on the hospital and on my office side to take care of people like you, people that have problems, and we make a difference and hopefully alter the course of people's lives, which is what we want to do long term and alter their course for the better. And you hear so many stories about, I had spine surgery and had this problem after. And look, there are complications and things that can happen, but there's thousands and thousands of spine surgeries that occur every year that go just like you. The surgery happens, and they end up with the results that you end up. And those are stories we need to tell because it changes the course of your life, changes the course of what you're doing. And to be able to walk and have the use of your hands can't be understated, in my opinion, in any way.
No, absolutely not. And also, as a side note, my klutziness has been resolved as well.
So we got rid of the klutziness and the tingles. I like that.
Yes, the tingles and numbness, yes.
Wow.
And everything's been great. But I would highly recommend Dr. Thomas and Crescent City Surgical Center for anyone looking for a doctor in place.
Thank you so much. Well,
thank you.
Enjoy the rest of your day, and thank you for your time. Okay?
Thank you so much.
All right. Thank you, everyone, and we hope this is helpful.